I'm Dr. Rojan Pokhrel. I'm a consultant psychiatrist currently working in Grandi International Hospital. And today I'm going to discuss on past questions that was asked in CEE on psychiatry. So our first question is, visual hallucination is seen in depression, schizophrenia, alcoholism, mania. So in this we have to understand what is visual hallucination, and even before that we have to understand what is hallucination. So hallucination is perception without stimulation. So what is perception and what is stimulation? Suppose a person, there is a stick and the person sees it as a snake. Then the stick is stimulus and the snake is perception. So if the person sees the stick as a snake, then there is also there is perception and there is also stimulation, and by definition perception hallucination is perception without stimulus. So it is not hallucination, but to call it hallucination, the stick should not be present. Means even there is no stick, the person sees it as a snake, so it is hallucination. And it is an example of visual hallucination, seeing things that unseen by others. But in the previous example we see that the stick is seen as snake. That is misinterpretation of the stimuli, which in that condition we can call as illusion. So and in this question, the visual hallucination is seen in the visual hallucination can be seen in alcoholism most commonly, and also in schizophrenia. Like in alcoholism there are different conditions like delirium tremens, alcohol-induced psychosis, and alcohol hallucinations. And the most commonly visual hallucination we can see is a condition called delirium tremens, which is seen in alcohol withdrawal. And in that condition we see clouding of consciousness, disorientation to time, place, person, and hallucination usually visual, like the person can see some another person or someone talking or other things, and tremor of the whole body, autonomic dysfunction including sweating, fever, raised blood pressure, and tachycardia. So in delirium tremens we can see hallucination, most commonly visual hallucination. And there is another condition, alcohol-induced psychosis. In this, this condition can be seen in alcohol intoxication or withdrawal, and it can be auditory hallucination or visual hallucination. And another condition is alcohol hallucination, hallucinosis, which is usually seen after abstinence of alcohol. That is, person is not taking alcohol for some time, and this hallucination is usually auditory. So from the current discussion we can say that it is most commonly seen in alcoholism. So our next question is, nihilistic delusion is seen with obsessive compulsive disorder, severe depression, schizophrenia, and generalized anxiety disorder. So first thing we have to understand what is delusion. And delusion is false and firm belief. That belief is unshakable and that is out of keeping with the social and cultural background. Means the same belief should not be shared by the other members of the community. And suppose if a person has delusion of persecution, he strongly believes he is going to be harmed by other person, or his family members are going to be harmed by other person. And that is in this delusion, even we give the evidence contrary to his belief, he keeps on believing that someone is going to harm him. So that is delusion. And now the nihilistic delusion is delusion of non-existence. Means the patient believes something is going to cease, or he may deny the existence of his body, his mind, the existence of their loved ones, and the old is going to be destroyed. And person may believe that they have no mind, no intelligence, and maybe their body or part of the body doesn't exist, and may believe my gut is rotting away, my intestine is rotting away. And in our condition, we see that nihilistic delusion can be seen in severe depression, or in some cases also it can be seen in schizophrenia, but more commonly we see in the case of severe depression. The next question is, which of the clinical feature is seen due to lesion on the bilateral amygdala? Loss of taste senses of food, mad for food, and it's whatever he gets, unable to experience the smell of food, decreased need for food. And for that we have to know one condition, that is Culver-Bush syndrome, which occurs due to the bilateral lesion of the medial temporal lobe, including amygdala nucleus. And the condition includes compulsive eating, that patient needs to eat more, means there is increase in appetite, there is voracious appetite. And there is hypersexuality, means increased sexual drive is also present. Hyperorality, putting anything in the mouth, means we can say that exploring by mouth. Visual agnosia, inability to recognize familiar people or other things. And docility, the patient becomes calm, means there is decreased aggression, there is inhibition of flight and fright response. Means what you understand is there is increased sexual drive, increased eating, putting everything in the mouth, and visual agnosia, and the patient become less aggressive, patient becomes very calm. So by this definition, now we come to the question. So in this, there is no loss of taste sensation of food, there is no unable to experience the smell of food, there is no decreased need for food, rather patient need to eat more, but there is mad for food, means there is increased appetite, and patient eats whatever he gets, putting everything in his mouth. So the answer is B. Now the next question is, labella indifference is seen in dissociative disorder, mania, depression, schizophrenia. What happens in labella indifference is there is absence of psychological distress despite having serious medical illness or symptoms related to health condition. Suppose the patient is unable to walk due to dissociative disorder, but we see that there is, even after unable to walk, the patient has no distress. So that condition is called labella indifference, and we see this in case of the dissociative disorder. And the question is, chronic alcoholic patient comes to the emergency department after 6 hours of abstinence of alcohol with restlessness, palpitation, agitation, and tremor. He also has tachycardia and hypertension. Which drug be used in such a case? Diazepam, naloxone, propranolol, naltrexone. So this is a characteristic feature of alcohol withdrawal syndrome. We can see there is 6 hours of abstinence of alcohol. Patient is not taking alcohol. So there is restlessness, palpitation, agitation, tremor, tachycardia, and hypertension. So these are all the features of the alcohol withdrawal syndrome. And in case of alcohol withdrawal, the drugs we commonly use are benzodiazepine group of drugs, and the other drugs that can be used can also be used are barbiturates. So in this question, the benzodiazepine group of drugs is diazepam. So the answer is diazepam. The other drugs that can be used are lorazepam, chlordiazepoxide, that can be also used in alcohol withdrawal syndrome. And the naloxone and naltrexone, they are opioid antagonists. Naloxone can be used for opioid overdose cases, like overdose like heroin, morphine. If there's acute overdose, we can use naloxone. And naltrexone, it is used as anti-craving agent for alcohol use disorder and opioid use disorder. And propranolol we can commonly use in anxiety symptom. So in the case of alcohol withdrawal, we have to use benzodiazepine group of drugs, that is diazepam. Now, what is the drug of choice for mania with psychotic features? So in mania, where the symptoms are elevated mood or irritable mood, decreased need for sleep, grandiose talk, and there are pressure of speech, flight of ideas. In such disorder, the most commonly used drugs are lithium and sodium valproate. The other drugs we can use are carbamazepine, oxcarbazepine. So in our option there is valproic acid. Most commonly we can use valproic acid, which is even more commonly used than carbamazepine. So the answer is sodium valproate. The most specific feature of psychosis is incoherence, neologism, perseverance, pressure speech. Incoherence means incomprehensible speech. In neologism, the patient uses new words or existing words in a new way, in a different way. So patient may develop completely new word, or patient may use the commonly ordinary word but in a different way. Like a patient may use the word car like air car or the airplane, or may use the word boat car. So that is neologism. And perseverance is persistent repetition of inappropriate words, like persistent and inappropriate repetition of words. So the first answer when you ask may be the right answer, but on subsequent question you would answer the same. That is perseverance. And in pressure speech, there is patient keeps on talking but very difficult to stop him, and this can be seen in case of the mania, or in also it can be seen in some normal people. And perseverance, it can be seen in schizophrenia, frontal lobe injury, dementia. And incoherence, neologism, both can be seen in psychosis, but among these the neologism is the most specific psychosis. Now thank you and best of luck for your coming exam.